start you with where the logo is in the middle. We'll turn into a dispatch. You'll hear a dispatcher. You'll have a response. That's your time. That time is for you to, with your crew, go over whatever you want to go over, talk about whatever you want to talk about. You'll arrive on scene of the structure. You ask any questions. Let us know what you're going to take with you. As a group, talk back and forth into the call. And when you're ready to depart the unit into the structure, you'll be greeted by the patient, or the patient will turn on. So I know that's a lot of to hit you with right after you were tucked under a desk in a tornado warning, as if, you know, it was a Cold War attack. You have any questions for us?
Is this video okay? Like, for what you guys can see, do you need to see more of us doing stuff, or is this appropriate?
I defer to Katie and Matt on that.
Go ahead, Katie.
I think it's okay as long as, like, if you guys do a med check, just hold it up so we can see what you're checking and everything.
Okay.
All right. So you have all your meds in your med vial set. You have one that's blank, just says sterile water. That's for you to use if there's a medication that you don't have in front of you that you need.
Gotcha.
Like in your region, you use X and we gave you Y, or you want X and we didn't give you Y. You'll pick the concentration, you'll draw it up and deliver it just like you would anything else that was labeled for you.
Okay.
So on your iSimulate, connect it to the internet. And did you go through and click the remote learning toggle?
I did, yeah.
Okay. Then you just give me the code you have.
2 Delta Uniform Kilo.
Delta Uniform Kilo. And which monitor do you want?
You want to do 15?
Yeah.
Lifetime, yeah, 15's good.
Okay. That one?
Yep.
Yep.
So do we interact with this on the screen, pushing buttons and all that kind of stuff?
Yep.
Okay.
Yeah. Anything you want. You want to get a pressure, you want to get a EKG, anything you want, you do on there. Talk to the patient. And then skills, you do skills aside. Yeah.
Are there any situations where we might need to ask you guys for something other than med control? Like if there's something that the patient can't provide, or?
I would say run it like a call. And if
Okay.
you don't get the answer you want, say, hey, I need this because this is where I'm trying to go with it. And it may be because we didn't pick up on it as one of the role players, and we'll give you that piece if it pertains.
Gotcha. Okay.
Yep. All right, any questions before we get started?
Scene safe PSI.
All right. Matt, Katie, Chris, you good?
Good.
All right.
Medic 30 Medical Emergency 4168 Westwood Drive 37-year-old patient general weakness for 30 minutes dispatched 1403.
All right, so 37-year-old patient weakness, 30 minutes.
Well, 2 different things. Their primary bag.
Yeah, I would definitely take first in ALS.
30 update on your patient.
Definitely
They
take
state
the
they are
cardiac
feeling
monitor
nauseous.
for weakness. Yeah, obviously scene safe BSI. Make sure we take goggles, especially with COVID, all that kind of stuff. Make sure we wear appropriate PPE, whether we
wear our
N95s,
Yep.
N95s, goggles. We've already got gloves and stuff on. You have anything else? I really think I have. I don't think I have anything off the top of my head.
I probably have our suction. It's kind of like American Express. Don't ever leave
Yeah.
without it.
Yeah, always have suction on the stretcher. Suction, monitor, ALS, BLS bag. Depending on where the patient's located, maybe a stair chair or something like that.
Right. There's no report of fall, just weakness. So.
Right, yeah, just weakness. If they're upstairs or no elevator, we can use a stair chair.
Is there any sound? Or is it just a picture?
I don't know.
Yeah, you're here. This is you're on scene.
Oh, so is this where we tell you guys?
Yep.
My apologies. All right, so looks like we're in a multi-story, probably an apartment complex or maybe a business. I'm not sure.
It's an office complex. You've been here before.
Yeah, so office. So we can consider making sure that we go ahead and take something like a stair chair with us because they might be upstairs. Maybe if they don't have a elevator.
You've been here before. They have an elevator. It has a Blue Star Life on it.
Okay, so the elevator does. Okay.
Get a free stretcher.
And so, okay, so we could make sure that we have a stair chair. If we needed it, we could come back and get it, but we can expect to take the monitor, expect to take the first in bag, ALS and BLS with cardiac monitors, and the stretcher, all that combined, and suction stays under the head of the stretcher. Anything else?
Yeah.
I think we're good.
Equipment if we needed it.
Yeah.
Hey guys, how's it going?
What's up, man? How are you?
I just don't feel good, man.
You don't feel good? How long have you not been feeling good?
Couple days.
Okay. All right. You have any medical problems we need to know about?
I don't think so. No.
All right.
No.
Start checking things out. I'm gonna apply a cardiac monitor. We'll take a look at your vital signs and stuff. Okay.
I'm gonna go ahead and feel for a pulse and. Okay. All right. So while he's doing that, I'm gonna go ahead and take my stethoscope and we'll listen to your lung sounds. Talk to you a little bit. How do I hear our lung sounds? I'm assuming I'm hearing clear lung sounds, Katie.
Yeah.
Cool. All right. So seems clear. All right. I notice you're coughing. What kind of milk? Yeah. Do we have the cardiac monitor on 3 lead, or excuse me, a 12 lead?
You gotta do
Yeah,
it.
you need it.
Hit the.
Probably button.
How old are you?
I'm 40.
Okay. Do you have any medical problems? Go ahead for a sec.
I don't feel
Any
good.
medical problems? Do you have any allergies? Take medications daily for anything?
No, I take a multivitamin.
Take a multivitamin? Okay. Okay. We see one complex and then a bunch of flat lines. Is that appropriate?
Put it up real quick.
Like to you to see?
Yeah,
We got one complex and then
No.
flat line.
that's not right.
Okay. Shut up. Please make that thing stop. Okay, while your guys are fixing that, I'm gonna just keep on talking. All right, so we're gonna do a standard assessment on working on the blood pressure. I think 90 over 48.
Is that correct? 90 over 48?
Yeah.
Okay, cool.
While we're waiting on this, what do we palpate a blood pressure at or heart rate at since we are unable?
Matches your monitor.
It says 0.
It says 0.
He's still alive.
Did you go in and license the iPad?
Huh? I went and clicked all the I followed your rules.
Here, I'll give you.
We got a blood pressure of 90 over 48.
Yeah, for purposes of time, it's not licensed. So we'll pause it 1 second.
I followed the rules on the PDF.
That's all right. Yep. Sorry.
No worries.
I kept seeing Sicily and he was talking. I knew that
Yeah.
could be right.
I was like, well, I mean, obviously he's got to have an LVAD or. Sir, where's your
So
controller?
don't worry about using the monitor on there. Just for time, I'm going to share my monitor with you.
Okay, yeah, that's fine.
So you'll just need to let us know what you want to do.
Okay.
All right.
And I'll start you where you were at. So the
Okay.
12 lead's going to pop up, okay?
Okay, yeah. Okay, there's a monitor.
All right. Heart rate 59.
Oh, he doesn't work. All right, so while we're working on the 12 lead, we've already worked on a blood pressure.
Still
I think it
90.
told us it was, 90 over 40.
Oh, no good, man.
We're gonna work on, okay, man. All right, so we're gonna work on starting an IV on him.
Yeah. Katie, I don't feel good.
Yeah, it looks like a second degree.
I know, Chris. That's why we call 911. They're here now. And they're gonna take care of you.
Okay.
This thing's supposed to have an extension.
Just, it doesn't matter. Yeah. All right, bud, so we're gonna take you over to the hospital. Which hospital you wanna go to?
I don't know. You
You
tell
just
me.
moved here, but
Wait,
there's
wait.
a hospital a couple blocks from here called Mercy.
I'm sorry, Katie, one more time.
There's a hospital a couple blocks from here, Mercy Hospital. He just moved here. He probably doesn't know, but that's a good one. He can go there.
Gotcha. Okay. All right. So IV started. We're going to hang a bag. You do a. You want to just do a saline bolus real quick while we mix?
Yep.
I don't feel good, Katie.
Hang in there, Chris. We go
All
to
right,
the hospital.
No, he's symptomatic. Yeah, let's prepare pacing pads.
Yeah, we're going to do pacing pads and put them on him. All right. So symptomatic bradycardia, ACLS. We'll put pacing pads on them. Can we assume that those are on now? Okay. Cool. All right. So pacing pads are on. We're going to hit sync or not sync. Excuse me.
No.
We're going to do pacing. I'm trying to get the video out the way.
A rate of
There we go.
70.
You want to start on 70? You want to start off at
Start at 70 milliamps.
yeah, so we'll do 70 and 70, see if we can get some capture. Does not appear to be getting capture.
You have to explain the procedure now.
I'm sorry.
Just explain what you would be doing with your finger.
Gotcha. Okay, so what we'll do at this point, since we're not getting capture, we'll slowly increase our milliamperage from 70. We'll go up to 80, see if we can get capture. From 80, we'll move on up to 90, see if we can get capture 10 at a time.
Checking
Okay, looks like we possibly have capture at this point. We're going to
mechanical.
check pulse, see if we've got a mechanical capture on him.
Obvious
Pulse
connect.
matches the pleth.
Pulse matches. Okay, all right. So what we're going to do is we're going to hold at 70 and 90.
Recycle blood
recycle
pressure.
that blood pressure. We got the IV started. You got a saline bolus 250 going.
What
Okay.
medical history?
He said he didn't have any.
No medical history.
Didn't have any. Didn't take medications. Wasn't allergic to anything. Just moved here from somewhere else.
Any family history? Any family cardiac history?
No, my mom's nice as a Hallmark card. That's about the only hard part. This shit hurts, man.
All right.
You had some
So
pain
how-
in your chest?
Yeah, I don't know what you're doing, but it hurts.
all right. So at this point, we're going to do some.
Blood pressure. We'll do 50 of
Let's do. Yeah,
50
50 mics of
fentanyl.
fentanyl. No. Cross check. Got it. I'll do
We got 50.
Yep, 50 mics of fentanyl. So this is currently mixed in 102. So I'm gonna draw up.
Secure the sharps. I'll push it through this door lock.
Okay.
Ah, shit. This hurts, Katie.
Right, sharps have been secure. We're gonna give him 50 mics of fentanyl for pain for the pacing.
All right. We're going to let's recycle a blood pressure with it.
Yeah, that
See
blood
if he
pressure.
has enough to tolerate maybe some sedation along with the pain management.
All right, so we already got 92 or 56. That's up from 82, 83. Or initially it went down to the 70s.
Katie, I don't feel good.
All right, man. So we got him in the ambulance. We've started an IV. We've got a fluid bolus going. We're giving him fentanyl.
Tell me what you don't feel good. We want to listen to lung sounds.
Listen to lung sounds. Lung sounds work clear.
Let's see if anything
I
changes.
just feel like I feel like I'm gonna, I don't know.
Okay. All right. So we're going to get a BGL. We got that appropriately. So his rate
was
is
the
70
BGL?
capture. BGL. That is actually really cool.
I don't feel good, Katie. I don't feel good.
Just hang in there. You're gonna get to the hospital real soon.
All right, we're going to make a load decision.
Yeah, I'd say priority. Let's go ahead and get him to the
Priority.
Yeah, we're already on the way. 98 sugar's good.
Katie, I don't feel good.
Just hang in there, Chris.
That was just a few minutes ago on that blood pressure, still in the 90s systolic.
Yeah, so fentanyl we gave 50. Okay. All right, we lost capture. All right, so at this point we need to transition from, see if we can get the milliamperes to push it up a little bit, see if we can get capture. All right. All right, so let's go ahead and hang some kind of, you want to get some kind of pressor or anything like
Check
that?
a pulse with it.
Yeah, let's check a pulse, see if we got a pulse.
Get an epi.
Pulse matches the QRS. Or, I'm sorry, the pleth.
Okay, all right. All right, so what we're going to do, since we had to pace him, we got him up to that. I think we should just go ahead and miss the epi drip. You're okay with that?
Drip.
Yeah, I think so. We're going to take epi. We're going to mix it into 250 bag. That'd be 4 mics per mil.
100 already spiked up.
Gotcha. Okay, yeah. All right, so we'll do it. We got them on oxygen, non-rebreather, 15 liters.
Katie, I don't feel good.
Hang in there, Chris.
I'm not gonna be at work tomorrow.
Don't worry about work. We'll take care of all that. We'll get you all set up and come over to the hospital and see you, okay?
Okay, I'm gonna take my phone with me. I'm gonna do work. Okay.
No, don't worry about work. Just worry about
Okay.
Check, we got- Okay, so we're in the ambulance making our way downtown. I'm gonna go ahead and get a second line. I think we can probably go ahead and drill in. We have a second line there.
I don't want to leave my desk, man.
It's cool, man. So what we're gonna do is we're gonna put you in the ambulance and take you down to the hospital. They'll make you feel a lot better. That way we can get you back to your desk as soon as possible. Is that okay?
I don't want to do anything. I just want to stay here.
Your last oral intake. Back.
We already used that other IV. We don't have any other options. I'm gonna go ahead and do an IO. Wipe clean. Choose my appropriate size for him. Push, contact, in.
He's still meditating up there. He's got a little tiny screen.
Yep.
Hey, buddy. How are you? Keep talking to us, okay?
I don't want. I just want to sit here and sleep. I don't feel good.
All right.
Needle secure, stabilizer, flush.
Do a, is he having a seizure activity? I can't,
That's from the,
no, look at the screen.
well,
Look at
I
him.
see him shaking. That's from the pacer.
Okay. Okay.
We could consider seizure-like activity. Chris, have you ever had a history of seizures, bud?
No.
Do a pupil check. How are our pupils? Pupils equal and reactive?
Yes.
Okay.
All right, EpiDrip is hung, starting at 250, starting at we say 4 mics a minute.
Yeah, we'll do it for 4 marks in the middle. Yeah, 4. Yep. All right, so that's hung. Fluid bolus was going. We've got IV established. We got IO for a second line just in case. Run a secondary blood pressure on that since we've got the epi going and now we've got the
Any update with the epi on board in vital signs? Was there any?
it's
There
right.
it goes.
Okay, there it is. Okay. All right, so this
All right,
this
so-
one we can consider that second dose of fentanyl for pain control.
Katie, are you there?
Yeah.
This shit hurts.
all right,
You
so
know, it's making you better. They're taking good care of you.
Oh,
There's a fentanyl. His blood pressure comes back. We might add some Versed into this.
Okay.
Might do. How about let's do well, let's do one of Versed. I think he can tolerate at least one. What do you think?
that
Give him
blood pressure.
something.
Yeah, I think we probably need to, if we're going to do that, we probably need to turn that epi up a little bit. But yeah, I would consider that with the epi.
man, it hurts.
All right, so blood pressure's up from what it was. He's now currently being paced with capture. The fentanyl's in. We can contact med control, see if
Yes.
they've got any pointers.
In contact med control. Do
Yeah,
we see
contact med
anything laying around the office that would give us any clues in his cubicle?
You know, he just started working here. He just moved here from Colorado, so he's just barely moved in. We just got him, you know, regular office supplies.
Any fever or cough as of recent? What's the temperature?
He hasn't complained to us about anything. We just thought he was getting used to the time change, you know, coming from Colorado to California, but he's been pretty tired looking. But
I'd like to palpate behind his calves, see if I feel any hot spots, bruising, anything like that from recent travel. Could have caused any DVT, anything like that.
And
Is there anything indicative of that?
Calves? My calves, man, this shit hurts. My calves, I don't know. You can look at them.
we'll go ahead and contact med control, give them the
Feel,
synopsis of what's
feel-
going on.
they don't feel fine. They don't hurt.
Okay.
What hurts is these pads, man.
Yeah, MidCon 702's online. Go ahead.
Yes, sir. Hey, we've got a 40-year-old male, went to a local business. He started complaining of feeling extremely weak for for the last couple days. Initial blood pressure was hypotensive. He did get down pretty low, bradycardic, looked to appear to be a second-degree block. We did start pacing him, got him up to capture at 120 milliamps, rate of 70, oxygen saturation is 96% on non-rebreather, 15 liters. Current blood pressure is 92/56. BGL was fine within normal limits. We've given him fentanyl, 2 doses for the pain for the pads. We do have an epi drip going currently right now that's supporting the blood pressure. Just calling in to see if you guys have any other.
What is this behind my damn knee, man?
Spot right?
Look at my calves. And this is behind my knee.
Yeah. Yep.
Yeah, I'm sorry. Were you looking for orders to do something?
We were calling. It appears to be. It looks like he might have a spider bite. We've got a what appears to be a bullseye on the back of one of his legs on his calf. Looking for any input you may have.
No. How far away are you?
They said we were right down the road from the local hospital, so approximately less than 10 minutes or so.
Okay. I would say that if you're not sure what the etiology is and you're managing blood pressure and he's mentating, to transport him into us, unless there's something else you'd like us to consider.
Having 10 cent on the spider bite or anything like that.
Does appear anaphylaxis.
What?
Clear.
Hurts.
Copy, thank you. I mean, I say we transport.
We did a 12 lead initially.
Yeah, we did a 12 lead initially. We could do a follow-up 12 lead on this, even though it's just going to be crazy
From
pacer
pacer.
spikes. Yeah.
Yep.
Blood pressure appears to be appropriate. Well, I don't want to say appropriate, but much better than what it was. He's maintaining appropriately. Sugar's good. Head to toe assessment. Checked his pupils. Didn't notice anything other than.
Does he have any type of sputum type reaction, salivating, lacrimation, anything of that sort?
No, I just got pads on my chest. I hurt like hell, man.
Do we notice anything on the head to toe assessment looking?
What are you talking about salivating? I'm not salivating. I'm in pain.
Okay.
We're at time, so we're gonna pause it right there. Good job, guys.
How do you feel?
Us or Chris?
You guys.
This is, I was telling Chris earlier, this is the first time I've ever done virtual, and it is really weird not physically touching or interacting with someone. We've done gyms, we've done all kinds of stuff, and this is
new.
Yeah, this is really different, really weird, awkward.
But thank you guys for being creative in light of COVID to come up with something like this.
Yeah, we appreciate it.